physiology, the bony structures of the ankle and foot. I think we were saying on Wednesday there is quite a bit to get through. We did all the palpations for the knee. If we have time at the end to review, we'll go back and do that. One or two of you mentioned that the Dr. Leba videos are actually available on Blackboard. I prefer those over the other ones that are available. Those are the ones that I like to watch to review. I just feel like they're more clear, and since she draws all of the little structures on there, it helps me visualize it for sure. But yes, we are gonna have to go through quite a bit today, so we'll have to move quickly. Please pay attention. Let us know if you have any questions. First ones, we're gonna start with our medial and lateral malleolus. These are fairly easy. I think you guys have palpated these multiple times just for various reasons, but on the medial side at the distal end of your tibia, you'll find the medial malleolus, and you can just start along the bone, come down until you start feeling that prominence. If you pick this during a practical, we just want you to make sure you're palpating all the borders, the anterior aspect of it, coming around, finding that inferior edge of the malleolus and then posterior aspect of that medial malleolus, so that way you know you're on just that bone and not at any of the structures. So your one finger confirmation would be medial malleolus. This one, please. Lateral malleolus, same thing, coming down that shaft of the fibula, down to the distal end, where again you're going to find that large bony prominence, but feeling that anterior aspect, posterior aspect, inferior aspect. The difference on lateral malleolus is you actually can get a little, I mean it's little, but a little bit of an AP anterior posterior or PA posterior anterior wiggle, because it's not the giant tibia. So there's a little bit of movement there, and that's how you can confirm lateral malleolus. One finger confirmation. Good. In between, let me see. I think this one's better. Okay. So then in between your medial and lateral malleolus, you're going to find your Tailless. Just say how you are. So you want your patient in just a slight bit of plantar flexion. You want to have those dorsal tendons relaxed. So you can come in from both sides or one or the other of the malleoli, it's up to you. And then you're coming in between, sinking deep to those tendons, and you should be able to feel that bony, large bony structure. The top portion of that is going to be called the dome of the Tailless. To confirm, you can push through the extensor tendons, and having your patient stay, can you scoot down this way just a bit, thank you. Having your patient stay totally relaxed. If you passively dorsiflex, the bone should move away from you. If you passively plantar flex, the bone should move into your finger. So that would be the dome of your Tailless. Okay? I'm so sorry.
Can you repeat? Passively.
If I passively dorsiflex, it should move away. If I plantar flex, it'll come into my finger.
Why do you not want to do those actively?
So extensor tendons will.
Yeah, big.
But all these big tendons can push you out. So then we'll do Sustentaculum. Yeah, okay. So Sustentaculum Tali, keeping that foot in neutral, and the reason you want to keep this foot in neutral is because if you let them relax in plantar flexion, you'll probably get a little too distal, and you'll be more in the navicular than the actual Sustentaculum Tali. So making sure that foot's in a neutral plantar flexion dorsiflexion. From that medial malleolus, you're going to come straight down. And then you'll feel, coming off the malleolus, you'll feel some more bones. If you keep going, you'll feel what should be the shelf of the Sustentaculum Tali. To confirm, you can fall off and you'll fall into soft tissues, which should be your abductor hallucis. So if you push into the side of your, if you can push into it's hard to abduct that muscle. It's not something you do often unless you're really good at displaying your toes, but you'll feel a little bit of muscle activation. So then when you know you're on that muscle and you come, relax, thank you, and you come straight back up, you'll feel that shelf of that Sustentaculum Tali. So that's how you can confirm that bone. Distal to that, the next large bony prominence that you should feel will be the navicular. And if you look at your medial malleolus and the head of your first metatarsal, it should be about 1/3 of the distance, and then it also should be the very apex of that medial longitudinal arch. Good there. So that, and it's a big one, it's very, very hard to miss. Navicular tuberosity, Just past that will be your first cuneiform or your medial cuneiform. You have your medial, middle, and lateral, or first, second, third. I don't know how you guys are labeling them. And it is between your first metatarsal and your navicular. So past your navicular, you can even come from both ends. I like to do that. You'll feel the base of your first metatarsal, not metacarpal, and then navicular, and in between those two will be a flatter bony structure, and that will be your first cuneiform. Do you want to stop there and practice that?
Yes. Good idea.
Okay.